Hi, everyone. I'm Nicole Fisher, and I'm going to be talking about our study, Perspectives of 281 Patients with MRKH on Uterine Transplantation. MRKH is defined as the congenital aplasia of the uterus, cervix, and upper two-thirds of the vagina. The condition affects multiple aspects of a person's life, including the ability to menstruate, engage in vaginal intercourse, and give birth. Several reports demonstrate that the most psychologically distressing aspect of this condition is actually infertility. Traditionally, MRKH patients desiring children only had two options: adoption and gestational surrogacy. However, uterine transplantation has emerged as a therapy, allowing MRKH patients to conceive, gestate, and give birth to their own genetically related offspring. To date, there have been over 60 uterine transplantation procedures and up to 18 live births. It's estimated that the amount of uterine transplantation procedures and clinical trials being done globally is increasing at an exponential rate. Of the uterine transplantation procedures that have been performed in the literature, the overwhelming majority, almost 90%, have been performed in patients with MRKH syndrome. So given that the popularity of this procedure continues to build and that the majority of the patient populations receiving this procedure are patients with MRKH syndrome, it is prudent that we understand the unique perspectives of this patient population towards uterine transplantation in order to best inform the field's efforts moving forward. So the purpose of our study was to understand the personal, ethical, and financial considerations of patients with MRKH syndrome towards uterine transplantation. We constructed a 60-item anonymous multiple choice questionnaire in Qualtrics and disseminated this to members of the Beautiful You MRKH Foundation, which is the largest international platform for patients with MRKH syndrome. Total 281 participants with MRKH from 31 different countries completed our survey. We found that the overwhelming majority of our participants was interested in undergoing a uterine transplantation procedure, believes that it should be an option for all women with congenital uterine factor infertility, believes that the potential benefits of the procedure outweigh the potential risks, considers it to be an ethical procedure, and also believes that health insurance should cover the cost of the procedure. Overall, this is very promising for the future of uterine transplantation in the medical community. We also noted that almost half of our participants noted a willingness to pay over $10,000 out of pocket in order to have the procedure. And when we asked the participants to rank the risks of the procedure in order of most personal importance to them, the risk to themselves, the risk to the fetus, or the risk to the donor, we noted that almost 20%, a large portion of the sample, actually ranked the risk to themselves and their own safety last. And so this raised our concern for potential patient vulnerability and maybe even potential patient financial exploitation, which we think warrants special consideration by the medical community moving forward. So major lessons learned from this survey study are fourfold. First, apply rigor to the informed consent process for this procedure, especially for MRKH patients. Second, providers who provide care for MRKH patients should be prepared to provide education about the uterine transplantation procedure. Third, providers should stay abreast of the literature surrounding this procedure and be prepared to engage with media and news outlets to share the most evidence-based information. And fourth, continue listening to the voices, perspectives, and thoughts of the MRKH community, especially as this infertility treatment modality becomes more available internationally. Thank you so much for your attention, and I hope you enjoy reading our study.